Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
Jennifer, thank you so much for having us today. Maggie and I are both regional coordinators, as you said earlier, for the Wyoming Center on Aging. There are a total of 4 of us that offer programs throughout the state to help implement chronic disease management programs. I'm based out of Rock Springs in Southwest Wyoming. Maggie?
Thanks, Jennifer and Kara. My name is Maggie Kougl. Like Jennifer said, I also work for the Wyoming Center on Aging as a regional coordinator. I cover the southeast corner of the state, and I am based out of Wyoming and excited to be here.
Thank you both. Our first question would be, describe what your project or your approach was and describe the concern or problem that you wanted to try and address.
So I'm going to go ahead and start with the concern or the problem that we wanted to address. So part of our work with working with the chronic disease prevention program is just making sure that people have access to tools that will help them manage or prevent some common health problems. So we, with Kougl, we really are working a lot with diabetes, hypertension, and other cardiovascular disease. So one of the things that we wanted to address is high blood pressure as a risk factor for heart disease. This project that we started is getting little tackle boxes with blood pressure monitoring tools inside of it. So it has a blood pressure cuff, information from the American Heart Association about what is blood pressure, how to manage it, sort of a graph or a chart of what the different numbers for your blood pressure mean. We were able to partner with 211 to get local resources for the communities. The kits have blood pressure logs. And I think this all came about, we were sort of chatting as a group one day about how to address high blood pressure. And Kara mentioned it would be really cool if you could check out a blood pressure cuff from the library the same way that you can check out a book. And so from there, we kind of delved in, did a little bit of research about whether it had been done in other places. And so we reached out to a couple other libraries across the country who have also been doing this. The first one that we found was a group out of Ohio who first started doing this in 2018, and they put these blood pressure cuffs into their library of things to check out. And then a few other places that were working on it are, Wenatchee, Washington, Pasadena, California. And we thought, okay, if they can do it, we can do it. And it's really taken off. Kara?
Yeah, I would just agree with all those sentiments. In Wyoming, we are lucky to live in an amazing place, but sometimes healthcare services are few and far between, especially in our remote areas. But one of the things that we recognized is that we have an amazing system of public libraries through our county library system. And so this has really enabled us to, we will be, by the end of June 2023, in every single county in Wyoming, which is awesome. And some of these counties, like I just delivered blood pressure cuff kits to Lincoln County. They have a total of 6 branch libraries in Lincoln County. And so small places like LaBarge, who has a post office, some gas stations, and maybe some other amenities, but does not have a healthcare provider, has an amazing library. And now at their library, they're going to have this blood pressure cuff checkout program as well. So it's some access to healthcare and an opportunity to work with hopefully their healthcare providers, even though they might be farther away, on monitoring those things. And one of the things that Maggie talked about was the resource booklet. This one's from Albany County, but it really goes over all of the things that she mentioned. What is high blood pressure? So a great resource for individuals. And it talks about how they can reduce their blood pressure through simple things like some diet and exercise. So great materials from the American Heart Association. And then just great visuals. So if you're a visual learner, how can you accurately take your blood pressure? And then, as she also mentioned, there's a section on community resources. And so one of the big things that we did with all of the different communities is that we partnered with Wyoming 211, which you can call them at any time for resources within your community. But we turned those resources into kind of a directory. So it lists the resource, what that resource is, because I might know what is 211, but maybe the general public doesn't know. So 211 is kind of like Wyoming's 511. We know that's for our road reports, or 811. We use that number when we want to go dig a fence or plant a tree and check out lines. Well, 211 is all of that place to call for general resources. And so this lists the resources within the community, their addresses, local phone numbers, websites, and those types of things. So if you are at home and have this kit, you're able to look into those other resources that you may be needing. The food bank, other healthcare providers, or even daycare options as well.
Yeah, I think so. Part of what we're trying to address is kind of just giving a little bit of healthcare autonomy back to the person who is concerned about their health condition. So if somebody is concerned that they've been going into the doctor and their blood pressure, is maybe reading a little bit high, or they don't even know sort of when they walk out of there what their numbers meant. What we're really trying to do is sort of increase confidence and self-monitoring some health conditions. So being able to develop the skills to take your blood pressure at home, to understand what those numbers mean, so that when you do go talk to your healthcare provider and you go in and they take your vitals and they say, oh, it's good, you can ask, what is good, or what are my numbers? And really sort of give a little bit of that power back to the patient.
What a great way to be able to make sure everybody has access, since libraries are in every place that you could probably think of in a town or community that doesn't always have all of the other things that it would need.
Absolutely. And we've already had reports back from staff members at the libraries that they have had individuals come in and just concerned because their doctors told them, well, you need to monitor your blood pressure, and they didn't have the funds to be able to purchase a blood pressure cuff. But those librarians have been able to say, guess what? We just started a new program, and I actually have one that I can check out to you. And so it's been some of those great stories that make us realize that this is definitely an impactful program throughout the entire state. So it's been really fun to get to see.
What is the aspect of the project that you guys feel you're most proud of?
I think I'm most proud of the growth of it. When we were talking to places, you can say that Wenatchee, Washington has this, or Pasadena, California. But I think for us to be able to say at the end of this project, to say the state of Wyoming has this resource available is really wonderful. And like Kara mentioned, being able to get these into, like, by using the county library system and using these smaller branch libraries, For example, there's a town in Wyoming called Centennial, and it's got a population of less than 300 people. That town now has 2 blood pressure cuffs, and we have seen checkouts happening of that already. So really being able to reach this rural and frontier community that is makes up so much of Wyoming, but is often can be sort of left out of the picture. I'm really proud of being able to reach that community.
Yeah, I agree. And it's been fun to get to work with the library system, because this is something new for us. and be able to deliver them a product also that they're proud to also show. And the fact that we've been able to customize it to every single community has been really great. That, we're really individualizing it to each county. And so I think in doing that, providing the best service to our community and to our state.
Do you guys have any advice for any others that might want to attempt to do something like this or mimic what you have started?
Just do it.
Just do it.
This has been, I think, one of the funnest projects. Not that all of our projects are fun, but this has just been so fun to get to work with the librarians and bring these devices to every single community and get to hear the stories about how they're being checked out, the differences that it's made in their community, and just that additional, it's one more potential access to healthcare that maybe they didn't have before, which I think we all recognized during the pandemic is so needed. And the fact that the librarians have been so open and willing to have a library of things, do another checkout, something it's not a book. Yes, there's a book in it, but that's not its real purpose. It's the blood pressure cuff. So the fact that we could bring that has been really fun.
Yeah, I'd say similar as Kara, I'd say just dig in and get going on it. What was really valuable for us was Kara and one of our other regional coordinators, Kevin, were able to go to our state library conference and bring a sample toolbox to that conference. And so that really drummed up a lot of interest, and we could reach a large portion of the state at one time, to the point where we've now had different library systems reaching out to us to say, oh, we want to be next, we want to be next. So I think that's really useful as far as collecting data, as far as checkouts to see if it's effective. We've been able to work with our state library system to get some of that information. And I would also say, if you're interested in it and you want to know more and you want a little help getting started, give us a call.
Well, with that, I think that we'll be done for the day, but have a wonderful afternoon. Thank you, everybody, for joining us.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.